Good morning. My name is Yanice Jackson, and I am your host of the Sunday Chronicle. I'm coming to you from Stax 92.1 FM. And today, my special guest is going to be Miss Yolanda Pope. And she is with the Dignified Aging Project. I would like to turn it over to Yolanda so she can tell you more about herself, her organization, and all those letters behind her name. Yolanda, thank you so much for being here today.
Yeah, hey, Yanice, thank you so much for having me. I'm really excited to be on the show. I've heard a lot about it. And so I'm excited to be here and talk about my organization and, you know, some of the current concerns we have about the community. So like you mentioned, I am the CEO and founder of the Dignified Aging Project. And we are an organization that was really built to act as a bridge in the community, for the community. We have a specific target to focus on the geriatric population and really supporting families and caregivers and seniors as they navigate through the aging process. But we also focus on all ages. You know, one of the big things that we worked with you with just recently was our mental health awareness and resource fair.
Yes, ma'am.
Which was, you know, for all ages, young, old, everything in between. So I'm really excited to be here. I'm a nurse. I've been a nurse for almost 16 years, working specifically with the geriatric population. I'm also a certified dementia practitioner, so I really dealing with dementia and cognitive impairment and really developing trainings and supporting families and seniors as they navigate through that process has been a huge passion of mine. And so I love to be able to give back in regards to that. And so right now I'm just really excited about the opportunity to currently work in the healthcare space, developing training programs as well for caregivers and for businesses, ensuring best practices as far as whether it's from COVID-19 all the way to, systems and operations. So we do a lot at the Dignified Aging Project. I think sometimes the question is more, what don't we do versus, what we do. So we're going a lot of different angles with the organization.
Well, from my viewpoint, all that you've done, it's been done well. So, hey, no complaints my way. I really respect the work you do and everything you're doing in the community. It has been wonderful. Thank you, Yolanda.
Yeah, and thank you. Thank you very much. You have been, our partnership has it's kind of just been instant. When we connected, it was all like we knew each other for years. And, we share some of the same values, have some of the same mission. And so it really has been a seamless partnership. And I'm looking forward to the future as well.
Yeah, I mean, because when you reached out, I looked at your website when you first reached out and you're like, hey, I'm doing X, Y, and Z. And I think we're doing similar things. I, saw your website, the Lansing Catalyst. And I'm like, yeah. And I looked at your page and I said, yeah, I think we are doing some of the same things. And so it's like, click. And, I was really amazed, the way we just were in sync. And I just believe that, when you're patient, things kind of fall in line like that. So I'm glad that I found someone to work with it of your stature. But going into that, and the reason I asked you here today, I wanted to talk a little bit about COVID-19 and the stressors, how we deal with the stressors in the community. And in addition, in certain segments within the community, how it affects us differently. So that was something that I wanted to cover. But once again, I want to let people know that I'm Yanice Jackson, and this is the Sunday Chronicle coming from Stax 92.1 FM. So, Yolanda, I know you've worked with diverse populations. You've seen a lot of things. I mean, before COVID and during COVID and now in the midst of it. And what would you say have been the biggest changes for you if you had to name like I'll just say one and two things. What are the biggest two things that really threw you for a loop with everything with this pandemic?
Yeah, I think when I think about that, it's a little bit. I'm in an interesting space because I'm also a frontline healthcare worker, and so as a frontline worker, my experience with COVID is it's twofold because I have how it's affecting me in my personal life, in my family, in my friends, in my community, but I also have how it's affecting me in the healthcare world and how it affects our ability to take care of our patients, how it affects our staff, how it affects recruitment. There has not been an area that COVID-19 has not touched. That's one of the things that makes this pandemic so unique. And we already know that racial and ethnic minority populations experience poorer outcomes than the general population for almost every health and social condition. So even COVID aside, our communities are already hit hard just by every health and social condition. And so when you add a factor in like COVID, it really it magnifies the issues that are already there. Yes. And I think primarily for me, definitely, we live in a more anxious community than we ever have, and people are anxious about catching COVID. They're anxious about going to work. You hear a lot about the workforce and how there's not enough staff. But what people aren't talking about and what's being left on the shelf in this pandemic is how we're addressing the mental health of the people in our community so they do feel comfortable coming to work. And so I feel very strongly about the fact that we really as a community should be pushing mental health just as much as we're pushing vaccinations. I'm pro-vax. My family's vaccinated. I believe that people have the right to choose, but I really feel like we really should be putting as much into mental health as we are into vaccinations, because the reality of it is, even if we're all vaccinated, yes, that's going to slow the spread, of the virus, and it's going to prevent it from mutating. Mm-hmm. But if we are all in such a horrible space mentally, because we know that our country is broken, and if we are in a negative space, we are going to still be in very bad shape. We're going to be protected from COVID, but we are not going to be protected from ourselves.
That you bring up a very good point, because I think just from what I'm observing, I think the physical effects of COVID are, I don't want to say more prominent in what I see, like in media and community, and we don't really touch as much on the mental health aspect of COVID and how it affects people, the things that cause the people to have mental anguish or whatever it may be. I mean, there's so many different stressors that we should be addressing, not just, as you said, or we talked about the physical, but we have to shift to the mental. We have to shift to that. And it has to be a regular thing. It has to be a consistent thing. And that's why I believe we should keep having these conversations. I think we should keep having the events to bring people in to be educated on different types of things, and not just one area, but holistically. But I wanted to run down a couple of stats that I took off of some websites, Yolanda, and I wanted to, just see what you thought about them and get a little feedback. But according to a Boston University study, depressive symptoms in adults in the U.S. jumped from 8.5% before the pandemic to 27.8% after, right? And this is 2021 information, or 2020 information. And so in 2021, there shows a jump from the 27.8 to a 33%. So basically what I'm seeing here is that 1 in 3 adults are dealing with some form of depression and or anxiety during this pandemic.
Absolutely. And I would I would challenge that statistic. I would guess that statistic is underreported, and that those numbers are probably something more along the lines of 50%.
I was thinking about that today because I said, now this says 1/3. These are of the people that reported. And that's what I was saying. How many people didn't because of the stigma attached to it? I mean, because these are smaller studies. These are, I'm not sure. It's just not everybody. It doesn't include everyone.
Oh, no, it doesn't include everybody. When you think about these statistics, and I don't want to get on my soapbox about this because I have a whole, I have a whole opinion about statistics and, who's included. But part of the population that you have to think about that aren't often included in these statistics are the incarcerated and the disabled. And, that's a huge number of people that are not always included. And, we don't look into, okay, why are these, obviously the disabled, that's not something that can always be controlled, but the incarcerated, oftentimes it's because of some of these symptoms, because of some of this mental illness or some of these challenges that we aren't addressing. And so we're not even including that population in the statistic when we talk about rating the community or the country as a whole and how depressed or anxious we are because of the pandemic. So the numbers are high. The numbers are very high. And I can almost assure you that you cannot walk or go into a public place without recognizing how anxious and stressed out we are as a community, without looking around and seeing how easily frustrated people are. The smallest thing, it's the smallest thing that causes someone to be upset or to be anxious or, everyone seems to be living on a very short fuse these days, which isn't healthy.
Yes, I agree. There is a level of anxiety these days. And for myself, I do try to remain aware of that. So I won't get caught in that hamster wheel of that, because that I really don't want to walk in that because it really can be challenging. So awareness for me has definitely helped. And when I get to that place, so with I would say in regards these stats that we talked about, you said that they're underreported, and I agree with you. What I wanted to talk about now is how minority groups are disproportionately affected by certain things, not only the mental and, physical aspects of it, but the barriers, the things the stressors that impact them that, whether it's income, or lack of resources. I wanted to talk a little bit about that and how that makes us more at risk. Are you? I believe you're pretty well versed on that, Yolanda, right? Yeah. And so we first have to acknowledge, like I mentioned earlier, that minority and ethnic populations, we have poor outcomes for just about every health situation. And when you think about that, and you think about our number one biggest risk factor is knowledge and access. Because oftentimes, because there's stress, depression, anxiety, these things have been so prevalent in the community for so long that people often don't recognize that there is something wrong. And so without the knowledge to recognize what mental illness is or what depression is or what anxiety is, it's very hard to fill out a survey and say that you're depressed or anxious because you don't know what it is. Right.
And then when you talk about access, oftentimes when people think about giving someone access to a resource, it's like, hey, we're going to put this resource inside this community and give the community access. And then oftentimes there's concern about, hey, it's here, but why isn't anyone accessing it? It's because people don't always know how to navigate in order to gain access. There's a lot of barriers through navigation, whether there's a communication barrier, whether there is a barrier transportation barrier. Maybe there is a confidence barrier in the system that's put in place. There's all these different barriers that have always been present. But now when you add the added layer of a pandemic that is also increasing the mental health, which some would say is a parallel pandemic, then that further exacerbates the issues that are there. And so I would say education and access are the two biggest challenges for our community, because you're not going to get help if you don't know that you need it.
Mm-hmm. Yeah. And the way that we start to promote awareness, we have to talk about it. We have to talk about these things. It is important, like our physical health. It's just, if not more than, we have to talk about these things. Because on top of that, in dealing with the other things that come along with the virus and dealing with race trauma and all of that, these things being layered, being stacked, we have to find a way to start going through these things and addressing these things and identifying what is what. And that's why I'm so glad that people like you, Yolanda, you're in there, you're down on the ground, you're in the trenches, and talking to people in the community. You're pushing resource fairs and conducting classes and consulting and letting entities know, powers that be, this is what it is here for this population. So you have direct contact, you have direct access, you're building bridges, right? And consulting people that used to say, do what I do, but you have that opportunity to say, well, this is what we need and this is what we do.
Absolutely.
Yeah.
Absolutely.
Yeah.
And in our organization, the goal is for us to be a vessel to facilitate the transition of essential parameters of care. So whether that be access to mental health, assisting support with cares for family that need assistance, because the voice isn't always there. And sometimes when the voice is there, we're not speaking the same language. And that's one of the big things and the big goals of the Dignified Aging Project is to make sure that we act as a culturally competent interpreter for the minorities in the community, so that way we can speak to their healthcare professionals, the doctors, to let them know this is what's needed, because the lack of cultural competency is another major barrier to healthcare and mental health access for the underserved minority communities. So we're excited to be able to do that. We do that through Crucial Conversations is our biggest platform that we use for that. And that is every third Tuesday at Schmidt Community Center in Lansing on Wise Road. And we have those crucial conversations. We share resources. We talk with people in the community to figure out what is it that you need? What do you need access to? We talk about the importance of advanced care planning and mental health. We talk about the importance of, being safe in COVID and dispelling some of those myths that are often contributed to our community. So the conversations have to happen. They need to be normalized.
Yes. Well, I'm glad you're out again. I'm glad you're out there doing that. And that is what a real leader does. And it's refreshing to see that, you don't need this big title and all this pomp and circumstance to go out and do some work. You're behind the scenes and sometimes you're out front, but you're doing the work. And it's not, to make this huge, local celebrity status or whatever. You're doing the work for the people and acting and serving as that bridge and bridging that gap. And I am I'm happy to see that there are more organizations that are community-based and they are raising their voices and wanting to work or insisting to work with, government and entities. We need to give that input. We need to give that input. People that are vested in the community, people that live here, people that know how things are affecting us.
Right.
We know how it's affecting us. We know how the shootings are affecting us. We know how, when resources are not easily accessed, how it affects us, and how it's a chain reaction, how it's a snowball effect when we cannot access the resources we need. And if we can't rely on government, which we cannot, then we do it ourselves as a community. We have to take care of us. We cannot rely on something or someone outside of us to take care of us.
Absolutely not. And that is actually one of the themes of Crucial Conversations is, there's no cavalry coming. We're the cavalry. We have to save ourselves. We always have. But the reality of it is, we're not going to really allow anyone else to save us. That's why we don't trust the doctors. That's why we don't trust government entities. And so, a lot of times when people say, we want the government, people insist that, our communities want the government to do this and the government to do that. Not really. We have always been very distrusting of government programs and incentives, just because the historic issues, with the community. And so,
and the barriers in place. I mean, there's so many barriers in place to even access those things,
Give us the tools to save ourselves. And that is my motto. Give us the tools, give us the resources, so that way we can take care of our own community. We don't want anyone trained to take care of the people in our community. We don't want anyone going through training to take care of us. We want to take care of ourselves. And I think that is another thing that's not often invested in enough, is providing the communities the resources to take care of themselves.
Yes, and it's again, I'm glad that you're able to act as a liaison. It's not the easiest thing to do to get access to resources, but you are one of those people. You are one of those people that will work on behalf of the people, that will find the funding to build the program, to supplement the programs that are taken away, where people don't have access.
Absolutely. That's the goal. So, we all got to start somewhere. And, it is nice to see, though, our community steps up. Our community has been stepping up for the community. And, as long as we continue to partner with one another and continue to support one another and utilize, the resources, take advantage of the educational opportunities, and equip ourselves with knowledge, then that's how we move forward. That's how we advance. That's how we fix and remove the stigma of, the negative effects of health outcomes, the negative effects of COVID having so much of an impact on our community, is taking charge and making things happen ourselves.
Yes. And once again, I wanted to remind you all that this is Yanice Jackson, and this is the Sunday Chronicle coming from Stax 92.1 FM, and I am talking to Miss Yolanda Pope of the Dignified Aging Project. We've been talking about COVID stressors and how we deal with those, and some of the disparities in the different rates in comparison to minorities and majorities and such. Yeah, name a few things that you do. I got a couple things, but I want to hear what you do to kind of put you in a good space and, just cope with this, what we have going on, this uncertainty.
Yeah, it's funny you asked that because me and one of my colleagues, we talk so much about self-help and, taking care of yourself. And I realized one day that I didn't know what I like to do as far as to help me wind down. Wow. And so I really had to look and do some introspection to figure it out. And so now I do have a practice of self-care. And, for me, it's music, it's art, it's crafts. I love painting. That is my retirement plan, is to paint. And so it's relaxing for me. I listen to music and I read books. But that's what puts me in my happy place. Everyone needs to know what puts them in their happy place, and not everyone knows that, and oftentimes you don't even realize that you don't know that, but it's figuring it out, what makes me happy.
Right. I would say for me, I do try to look at the silver lining of everything we've went through with COVID, and it did push me back to my artistic side. So when that pandemic hit, I started writing poetry again. I started writing articles and working out, dancing. I went biking again. So I didn't gain much weight during that time. So I was grateful for that because I did a lot of exercising because it really helped me stay balanced. And biking was a big thing for me. And also the community service, even still, that keeps me balanced, knowing that, if I'm feeling a certain kind of way, if I'm anxious, if I know I can go out and help somebody else, I can help somebody, I can help with food access. I'll get them some food, or maybe somebody needs a coat or something. So let me go out and do that. Let me make a few calls and serve. And that keeps me in a very balanced space, not so all over the place. So that's what I do to cope, and it's been wonderful, writing, dancing, biking, serving. So
yeah, I definitely think that COVID has allowed us to tune into ourselves. That
yes.
is, I'm glad you mentioned that, because that definitely is the silver lining, is you've got a chance to focus on yourself and what makes you happy. And, once you know what that is and you're able to incorporate that, that's going to prevent that stress, that anxiety, that depression. But we need to help get our community there.
Yeah. And we can, and we're getting there, we're getting there one step at a time, and we're getting there together, and it's all about sewing together the fabric of the community, because community knows what community needs. And that's why we're here today. We are a platform for community. And with that being said, we want to thank you for one more week of the Chronicle. I thank my guest, Yolanda Pope, for being here. I'm Yanice Jackson, your host of the Sunday Chronicle, coming from Stax 92.1 FM. Make it a great day.